clients choose someone, at least one person, if we don't have enough certificates, that's been doing well through the program, to get one of these certificates and go to one of these restaurants for a meal. It's all paid for, you know. We have a lot of bicycles that people donate, so we use those. If you look at NA or AA, they have coins and they have, you know, chain things, you know, so they provide, you know, think about it, how many of you are graduating from your master's soon? I hear some of you. Raise your hand. Big accomplishment for you. You should be very proud of yourselves. And guess what? You know, the university is going to give you a certificate. And you're going to have the whole robe and the hat and everything, and your family is going to throw a party. I mean, it's a big deal, right? And so, you like it. And if they don't do it, you'd hate them for it. And so, it's the same thing on this. And they find out that really, if you use a lot of positive reinforcement in addiction counseling, that it really works. Not many people have been able to say kind things to them throughout their life. One of the things that helps me is that I'm very strength-based as a therapist, and so it really, they kind of feel that, and it translates in some of my work with them. Not many people have been able to tell them, you know, you should be proud of yourself, or I'm proud of you, or you're doing well, let alone give them a certificate. But this alone was found to be a huge motivator during the testing of the matrix model as well. So people who, you know, used contingency management, you know, really they were providing more and more negative UAs throughout the treatment model. That means that they were staying sober a lot longer or more than the rest of the clients. All right, so family systems is the other one. I have to start by actually on the negative, right? I'm strength-based now, start on the negative. The matrix model does not do justice, you know, to family therapy the way we want it to. But in comparison to other models, it's very inclusive. It actually states in the manuals and in the handbooks that services should be provided by a family therapist or a licensed psychologist. And just that is big in and of itself. Are you guys here? I thought I was developing some symptoms. It's not here. But every family has a structure. You know, there's a hierarchy, and there's rules, roles, rituals, and boundaries, and how they function. You know, and in a family with addiction, when addiction is present, you know, it really kind of has ripple effects. Addiction becomes sort of the Steinberg used to say, the organizing principle of the whole family. Think of it this way. You have a birthday, and your dad is using, or your mom is using. First, you wonder if they're going to throw you a birthday. Are they going to be sober? Do you want to invite friends? Or do you want to save the embarrassment and not invite your friends at your house because you don't want them to learn about your mom or your dad? Or in a normal just summer vacation, do you invite your friends at your home, or are you scared to invite them at home and you just want to go to other people's houses? I mean, it's a big family secret in some way for kids and other family members as well. But everybody's thinking about, think about like Thanksgiving. It's going to be drunks. Oh, by the way, Charlene is coming for Thanksgiving. No, you guys all need to be nice to her. Just because she's an addict, that doesn't mean anything, okay? It's once a year. We just think about it. I mean, these are, and that's what Steinberg really meant, that it becomes this organizing principle. And now in recovery, really recovery has to become one of these organizing principles in order for it to work. So family systems, you know, it's sort of included there, and it has a big manual, and it has 12 sessions, and it does focus on a lot of those things. We'll go into those, but it's included in it. Well, you all are familiar with what is that? The four, yeah, thank you, horsemen of the apocalypse, right? So, I mean, these are dynamics that go on in every relationship, but in families with addicts and alcoholics present, when addiction is present, they're just there, plus a lot of just other problems that they have in their communication and interaction patterns that have to be addressed. What's really kind of interesting to know as family therapists is that what Steinberg, for example, found, okay, research often shows that divorce rate among people who struggle with addiction spikes when a person gets in recovery, not when they're using. And what he found out with a lot of patients in the hospital is that during the time of use, or when the person had just hit rock bottom, you know, let's talk about, you know, what's a rock bottom. He found out during that time they're very connected. They really want the best for their loved one. But when people get in recovery, now I was thinking about that one day. Why is it that when they get in recovery? And I was thinking about our treatment models. When I was, you know, as a residential counselor, you work with clients, right, individually, but we never see their family most often. And we tell them to develop their recovery plan and where they're going and what they're going to do and how they're going to stay sober, how many meetings they're going to go. None of in their recovery plan has anything about family. Never did we ever meet with the family. So they're totally left out. And sometimes I think, like, are we contributing to some of that data, you know, as a field, not really engaging the family and services? And I don't know. But these are just some findings that we have. I'm going to move on through that since I talked. Okay, according to SAMHSA, there's two major reasons why we should involve families in substance abuse counseling. And one of them is that they're a big resource. Think of common factors. We say, well, you know, what is it, 30% of the reason why client, it's 30 or 40, I think, why the reason why client changes is because of their extra therapeutic factors, the supports that they have and what they bring to the table. And then it's the relationship, the big one, and then it's hope and placebo, you know, effect that it has, and then it's our techniques that we use, right? 4 components. So we want them to really be supportive and be there for the client, but at the same time, SAMHSA said that, you know, really the other reason why we should is because there's a lot of pain that family members go through. And we want to be able to help family members go through that pain and help them through that challenging time. There's other goals, but those two. How many of you are familiar with treatment improvement protocols? How about tips? They're called tips, yeah. Free books. They're really, really good. And tip 39 is really good on explaining family therapy and substance abuse and how the two interact. And tip 35 is on motivational interviewing, you know, so I highly recommend you check those out if you kind of think about maybe addiction being part of your practice or as you move forward with your career. So that's tip 39, and it kind of explains some things. And all right, so motivational interviewing. So a lot of you raised your hand when you said, okay, we know what's motivational interviewing? You can talk about that slide. Yes?
I mean, it's essentially like interviewing or talking with clients and helping them to develop their own discrepancies so you don't get in this power struggle. And so that they can be kind of an active player in their change process. Excellent,
excellent. Yeah, so one of the ways how you help clients in motivational interviewing, Arnold, did you raise your hand? Is that you want to develop these discrepancies between the way they feel and the way they act. Sometimes I play dumb. I go like, I don't really understand. I mean, one side you tell me you really care about your family and you want to stay sober and you want to do this, but on the other hand, you're fighting over here with the judge and you're meeting with Joe, which is your drug dealer. help me. And they go like, okay. So sometimes you develop these discrepancies and they have to convince you as a therapist. You know, what else? What else do we do?
A lot
Yeah.
of times in motivational interviewing, the clients don't see that their own value, or they feel like nobody understands their struggle, so you
Yes.
empathize with them and kind of say, you know, it is very difficult to be an addict and still live in the environment that you have. So even to be a voice that says you're heard, do that to get into a place of exactly what she said, taking accountability, feeling like they can be an agent of change for themselves.
Yeah, being empathic, but also affirming, right? Some of their feelings, and yeah, absolutely. You want to express empathy. The biggest thing with motivational interviews is that don't fight with them. I mean, and the understanding of stages of readiness to change is very important. People change slowly. You know, they have their own pace. You know, when you make major decisions in your life, you don't make them easy and quick and overnight and boom, you're done. You know, it really takes time, you know, to kind of develop those, make those decisions and move on. So understanding that process is really important, and going at their pace. Usually, kind of like more solution focused, they use a rule or two, just in a different way. So, you want to kind of find out how ready are clients to quit, how interested, how important is it for them, or willing are they to quit using drugs, and then how able are they to quit using drugs. These are some things that you ask, you know, on a scale of 0 to 10, you know. And then we'll go to this here in a minute again, because we're going to ask some of those questions, how they're different. But I wanted to explain that I care less how confident they are about staying sober as a counselor. I can help my client build that. So initially, what my major focus is on their interest to get sober. And here's what I mean. You're facing prison. How much do you value your freedom? How much do you want to stay with your kids? How much do you want to be a parent to your kids? I focus a lot on their relational aspect. I focus a lot on their health as well. And once I am able to increase their interest, that sobriety probably is a positive thing for me to do, then I can work with their confidence. Because their confidence is shot because everybody around them told them you're just an addict and you don't amount to anything, and you're just never going to get sober, because they tried too many times and they just didn't make it, and they burned those bridges, and now they just kind of feel hopeless, you know, a lot of them. But I can work with that confidence. I can build that up later as I go.
It's a struggle in that, in a lot of ways, I don't want to stop getting high, but my life has gotten better, it's gotten less complicated, and I really have no choice, so it was either go back to prison or go into Prop 36, so here I am, a willing participant.
There's a technique called motivational interviewing that's really built into this matrix treatment that we do, which looks at that ambivalence and helps people look at it in themselves and tells them it's not unusual. In fact, it's typical. That as you're dealing with your own addiction, part of you is going to want to stop, and part of you doesn't want to stop, and that's the addiction.
We don't have an expectation that when they walk in the door, everything's going to change and everything's going to be great. We meet the patient where they're at. If they're still ambivalent, then we'll work with their ambivalence.
The outcome data suggests his potential for doing well in treatment is just as good as someone who walks in voluntarily.
All right, so by the way, 10:30, in 10 minutes, we're going to take a 15-minute break. So I just wanted to, the break, we got in the morning. And so I have a client, he loves guns. And so he's got so many charges that now he found out that the only way he was going to continue his love for guns and own guns is for him to go through the recovery court or drug court process. And he is, like this other guy, a very willing participant in the process. He understood, I mean, he hated me, he hated the judge, the prosecutor. Remember, just because you're a counselor doesn't mean, you're part of the hierarchy. You're part of the institution. So in one way, you want to decontaminate yourself from the judge and the PO and all of that a little bit. But at the same time, you're part of the team. So clients will always look at you as, but you gotta find, you really gotta find the aspect that, helps them. Frames or, the way you provide feedback in motivational interviewing is a really cool tool. You kind of really find out what's important to them or what's, through your assessments, what's coming out. So like that Addiction Severity Index MV provides me a really cool tool. One of them is a little tiny box which shows how big of a problem this is for the client and what is their perception of it and how willing are they to change. And most often it picks up nuances like, yes, it's a big problem, in one sense, but I really care less about it and I don't think I need to do anything to change. And when you find these differences, right, here's the discrepancy you have, and I point those out and I provide feedback about those things. Or I provide feedback about, the health aspect of addiction maybe in their life. And whatever I have to my assessment, the idea is to provide that feedback in a way that is very organized, based on science, and very empathic, so that you're not kind of non-judgmental. This is where you are, this is what's going on, and this is where you're headed, and the prognosis doesn't really look very good for you. Might be prison for the next 10 years or whatever, And so you want to be able to then look at things that they may have and maybe empower them to make the right decisions. You're a co-participant. But yes, it's the client who makes the decisions. Yes, it's the client who has to do the work. But you're a co-participant in that process. And you have some responsibility as to, in terms of the decisions that your clients will make. I'm not going to go through the stage of change process, but our role as therapists really is to kind of dance and not wrestle and really be able to help the clients move along that process. One of the big things that I find with, and yes, I was that therapist when I finished school. I was out there to change the world, and everybody on my caseload was moving within a couple of weeks from pre-contemplation to action. Thank you. What's wrong with that? Why are you laughing at me? What is wrong with it? Help me, you're right. Go ahead.
Too quick.
Too quick. But they were doing well. I was like assigning everything to them, and yes.
You're doing it on your time and not theirs.
Yeah, I'm doing it at my pace. I'm assigning things. I'm forcing them to go here and go there. And they would attend a meeting because I made them attend a meeting somewhere. And they were like, okay, action stage. So we gotta really understand that process well. And it took me a while to learn that through practice, That it's not about me first, and it's about them. And second, to really go at their pace. How many of you grew up in a farm? Okay? Just me and Arnold? All right. You too, Dr. Brooks. All right. But, every time I got on one of my donkeys or horses, and I wanted them to go really fast, because they were not going as fast as I wanted to, I would hit them and hit them and hit them. And by the time I would hit them, so that they go fast, they would get tired of me hitting them, and they would just throw me over. Your client will throw you over. At one point they will stop showing up. They will maybe look hopefully for another therapist or something. So you kind of gotta go with their pace, and understand that process well. All right, so on a scale of 0 to 10, as we prepare for our break, how interested were you in really coming to this event in Philadelphia? Now, I know all of you will say it, and Dr. Brooks is not here. She just left, so so this is what kind of look at. How interested were you at coming to Philadelphia for this event? on a scale of 0 to 10. 0, I really did not want to come here. 10, I absolutely wanted to come. Any brave souls that don't have a 10? Yes.
5.
5? Okay, anybody else? 7. Anybody else?
5.
5. Wow. So that's a big number. 5, you know, that's pretty high. So why not a 0?
Because this is my second year as a minority fellow, so I kind of know what to expect, and I saw some of like the presenters and were interested in some of the topics, and I knew some folks here, and so there's like the relational piece for me,
So you're saying that one of the things that doesn't make you a 0 but a 5 is because you saw some of the names of the presenters, relational, you really wanted to come and see that. Yeah. What else?
Having time on the plane to like read, I kind of like that. 'Cause I
So
can't
you wanted
focus,
some
like,
time on your own,
otherwise.
get on the plane and get here. Wow,
Time away
okay.
from home and to just like have a slower pace of things. I drink more water at conferences, which is good for me.
Drink more water, so it's a healthy thing. So far you're telling me you're a 5 and not a 0 because you really liked some of the names of the people and you wanted to meet them come in here.
Yeah.
And that you like drinking water and that's healthy for you. So you wanted that to be, and then you wanted some time on the plane to read. So you got me 3 things to be a 5, and 5 is pretty high. So what else could be there that makes you a 5?
We got breakfast. That was pretty good.
You got breakfast, so
I
that
didn't
was
have to worry
really
about making
cool.
it myself, yeah.
Yeah, so you don't do it for yourself at home, so you kind of came up here doing breakfast, that's
Yeah.
cool.
Yeah.
Yeah, me too, yeah. What else? What else interested you to come here to the conference?
Being able to meet like new folks and connect and make new relationships.
Being able to meet new people and connect and make new I could go on and on for another 5 minutes with her. It's very important for me not to move away from that. And I will build a long list of her interest to come here at this time. Even though you should have seen her face, she was both scared and concerned about throwing out her number, and then when she came out, he's like, I'll say it too, it's 5. Yeah. So, but she was like, I can't make that thing. 5, should I even say that? Clients will do that too. They'll assume that you want to say a 10 because you're going to call their PO or judge or whatever. And they may say a 2. I asked them to be honest with me. 2. 2 is a big number. Wow. Even if it's a 1. You know? I work with them to build from whatever brought them there. It may be the water, the breakfast, it doesn't matter, right? These are points where you can motivate people to change. That's the really cool part about motivational interviewing and the scaling questions that they have. And there's been a lot of talk about maybe solution-focused motivational interviewing, trying to link the two and all of that. But that's what it does. It builds her motivation to say, wow, I am here, and you know, I shouldn't feel bad because I'm kind of interested about coming here, and I'm going to meet these new people. I'm going to drink more water and have breakfast and have more time on the plane on my way back, and it's not too bad as I thought it was. Initially, she thought a 5 was bad, but now she's beginning to think that a 5 ain't bad. So what's it going to take? What would need to happen for you to go from a 5 to like a 5.5? Would like a break right now? What would need to happen? Well, let's take a therapeutic break. Think about it.
Okay.
And then we can talk about it afterwards since it's 31. Let's take a 15-minute break.
Consult with the team.